Thank you for stopping by Masks Off, uncovering the latest topics that you need to know about, from business, human trafficking, teen-related issues, mental health and wellness, and everything in between. Stay tuned for your host, Toseika Thomas, keeping it real, honest, and relatable. Welcome to Masks Off, where we discuss the good, the bad, and the ugly.
Hello, 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 and welcome to Mask Off. I am your host, Toseika, and we are here with LaDia. And today we're going to talk about the struggles in the healthcare with healthcare workers. LaDia, do you want to introduce yourself?
Yes, thank you, Toseika. I am honored to be here today. Thank you for inviting me. So my name is Dia Selmer, and I am from Houston, Texas. I've been a nurse for over 15 years, a registered nurse. I've worked in many different fields. I started my career in Houston, Texas, and I moved to Chicago 9 years ago, almost 10, and started my career in leadership in corporate America. So I am now a corporate nurse. I do hold an MBA, and I've been in corporate now for 9 years.
Okay. So a lot of us know about the struggles. Well, we don't know. We hear about the struggles that a lot of the healthcare workers dealing with COVID. But we only hear what's on the media, so we never get a chance to hear from healthcare workers for ourselves. So can you explain to us some of the struggles that the healthcare workers dealt with prior to COVID, during COVID? What are some struggles that you guys deal with?
Yeah, that's a great question. And I think, when we started dealing with COVID and the struggles of COVID, we faced a lot of the struggles that the average American faced, and having to deal with the shift of the unknown. We were learning a lot about it, just as well as others were learning a lot about it, and the research was coming fast, and there were many changes that was just happening very prompt. So we had to quickly adjust and get prepared to, take care of people in the hospital setting, outpatient setting, whatever that may be, but also taking care of ourselves and trying to stay solid and strong for others as we are taking care of them and trying to understand, what's next or what's to come. So this happened, COVID happened about 3 years ago, I would say, approximately. And we've seen a huge shift in healthcare overall because of the unknown and a lot of people being impacted by COVID, whether that be family members experiencing very chronic illnesses or those that was experiencing chronic disease and being impacted the worst, and the number of people that expired due to COVID or the symptoms of COVID or the struggles of diseases that they had prior to COVID and them being impacted the most. So it did take a toll mentally, physically on healthcare workers. Again, trying to understand the fast-paced movement of what we had to adjust to in hospital settings, outpatient settings. And again, it was changing pretty quickly for us. So I think the struggle with just the stress overall of trying to understand what was happening, but also keep up with the scientific side of research, evidence-based practice, and all of those things that was coming at us that we had to grasp pretty quickly in order to educate our patients in the communities.
Okay, wow. So was it a struggle dealing with this change and trying to balance your life with family, because it was scary for everyone? So can you talk a little bit about how that kind of
Absolutely. Yeah, so I think that goes into the during. So the pre, while it was happening, so during the pandemic and when all of the shift and the isolation and the quarantine and having to be isolated away from our families, that was a struggle within itself because, we did not have the opportunity to flex back and forth. You work a 12-hour shift, a 14-hour shift, and you may take care of a COVID positive patient and you go home, right? But that wasn't the structure or the protocol that was in place at that time. While they were working on vaccinations and working on a plan to, treat COVID or the symptoms of COVID, we had to quarantine and isolate ourselves away from family members and friends and, as well as the community, businesses closing and hospitals, being very strict about entry and visitations. And so things changed so quickly that it did not give people an opportunity to truly process what was happening. You basically had to fall in line with what the CDC, the government, and the federal government was saying that we needed to do, which can be a huge stressor for anyone if you don't truly understand the science behind it.
Yeah, that's true. And speaking of the science, a lot of times, especially when it comes to science, and there's always a concern with the public, there's always finger pointing, and it goes from either the management or political. A lot of people like to blame the president or Congress or whoever. Do you feel like these struggles came from the lack of training or the lack of knowledge from management or from politicians?
That's a heavily packed question. I don't think that it came from lack of management. Okay. And some may think that it was political pitfalls, but, everyone have their views about it. So for me, I would think that management, whether you're in management in corporate America, as far as healthcare, or if you're working bedside, we were all learning about COVID, right? And what this meant and what's happening and what we need to do next. And information was, being triggered and shared amongst, hospitalists and medical professionals pretty quickly. Right. And these were protocols and processes that we had to implement fast. Right. And some of these things we had to then share with our employees or our teammates, where they also had to process these things pretty quickly. Right. But that's what we do. I mean, as healthcare providers, as healthcare workers, we take an oath to care for people, to care for our community, and to educate those that don't lack the knowledge or don't understand what's happening in healthcare. It is up to us to help them understand and share that information so that we are making the best decision to save lives and to treat those that may be struggling with diseases or that may have been impacted with COVID. So it's hard for me to say that it's a political gain or, lack of management. I feel that it was lack of knowledge across all spectrums, whether it's management in healthcare or politics. But as we all learned more about COVID, how to treat COVID, how to save lives, we continued to then share that information so that it would be beneficial to everyone, so that we're not losing anyone due to this virus.
I'm gonna jump back to the family real quick. So a lot of people don't understand that, like you said earlier, you guys did have to sacrifice being away from your families for a long period of time to take care of other people. What type of mental struggle was that or what type of mental struggle was that, dealing with sick people, but still at the same time worrying about what's going on with your personal life?
Yeah, again, great question. And it brings back a lot of emotions that I had at the time when I had to face taking care of COVID patients and had no idea what I was walking into.
Right.
It was hard for me. Because there were so many unknown questions that, I didn't have. And COVID impacted many people in so many different ways. Being asymptomatic, meaning those that didn't have any symptoms, and then those that were chronically ill and had symptoms. So I found myself adapting to that individual or adapting to the situation at the time that I had to, either be more focused on this critically ill patient versus prioritizing and monitoring another patient that's not so sickly.
Right.
And then coaching my team on what it is that they should be looking for, the documentation that we had to have in place. And it can take a toll on you mentally. But again, I think for me, I always think back to what if it's my mom, my sister, my brother, a family member sitting in this chair or in this situation, what would I want for them or what would I want for myself? So I have to take away my personal feelings and set that aside and make sure that I'm here to be a professional, to coach my team, to be professional, to do what it is that we took an oath to do, which is care for others, and make sure that we are giving it our best and providing that quality care that people deserve.
Right.
So at the end of the day, when I am done with my work, which for me in corporate, I'm never done. It's 24 hours.
Right.
But when my team, when they're done, I then encourage them, take time for yourself. When you're at home and your day is over, you take time for yourself, you detach, you relax, and you enjoy the time for you because you need that. Every individual that's, regardless of the field that you're in, but especially in healthcare, you must take time for yourself so that you could reset and be ready and prepared to give your best that next day. If you are not able to reset and give your best, then you are no good for the next person if you're not good to yourself.
Okay, so let's talk a little bit more about the emotional part, because I know, of course, I was sitting at home, but you're watching TV and I'm sure, well, I know the media sometimes can make things a little bit worse, but you guys were sitting in the hospital, literally watching these people die. And I know being in the medical field, you're kind of prepared for death, but we're talking about rapid death, left and right. How did you guys cope with literally walking into a room and then 5 minutes later, this patient may be gone?
Yeah, well, for me, given that I'm in an outpatient setting, I see, I hear, and I'm impacted with reports and things that I am receiving from an inpatient, which would be the hospital setting.
Okay.
It's scary. There were patients and people that I've known that was admitted and we thought that they were okay. And unfortunately, they were not. They did not return to us. That hit home and felt very personal because you develop relationships with individuals and you never want to see anyone go. And when you get the news that, someone has lost their life due to this virus or struggles with any chronic disease, it's touching, it's emotional. And it's hard to remove yourself from that because we are all human. And again, we have to understand the process of life. We have to understand how to treat certain diseases, to prevent those things from happening. But, it's unfortunate that we went through this spiral where we were trying to figure it out and trying to figure it out quickly in order to save lives. So those that we lost, my heart goes out to those, individuals, those families. Prayers go out to those families, even now, because COVID is not over and we're still dealing with this. We definitely have to be grounded and be more knowledgeable about how to prevent these things. So it starts with education, educating yourself, healthcare workers, educating communities, so that we are better prepared and taking care of ourselves and preventing death or preventing symptoms from being worse.
And so hearing that, I have another question. So we know COVID taught us that anything can happen at any given moment. And we know that we have to be able to, do quick switches in order to kind of cope with life, cope with what's going on in reality. How do you feel the medical field is equipped now going forward than it was maybe 4 or 5 years ago? Do you think that if something else happened that's totally different from COVID, that we will have this same downfall? Or do you think that, hey, COVID taught us enough that we need to stay one foot in front of the other?
I think COVID was an eye-opener. I think COVID was definitely an eye-opener. Things have definitely changed in the healthcare setting over the last 3 years. We did see a shift with healthcare workers feeling overwhelmed and tired. And I think that's what led to the Great Resignation.
Right.
The frustration and the emotions behind whether what their beliefs were, right? Because when the vaccines came out, we had a divide. You had some that believed in it, you had some that did not. Then you had mandates that came across, and it was dependent on the state that you were in, on the mandate that you followed.
Right.
Some states required you mandatory vaccinations. Some states did not. So where we saw the most healthcare workers resigning was those states in those hospital settings that was demanding that it was mandatory.
Right.
Now it's unfortunate because we lost a number of healthcare workers, which we were already short of healthcare workers and nurses, right? So if we're already struggling with a nursing shortage, and now here we are caught up in a pandemic that has divided, the opinions of healthcare workers. Now we have a number, thousands of those that have decided to either resign from healthcare and start new careers, or transition into a field that did not require them to, follow those mandates, or work bedside where it was as stressful. So, that being said, it has definitely been a change in healthcare. And it has certainly led to, I think, a different type of struggle, where you're not only short-staffed, it's hard to find staff.
Right.
So you still have struggles with hospitals not being able to staff and open up all of their beds for the number of patients that they have sitting in the ER. So those wait times are longer. And then in our outpatient settings, we still struggle with the number of admissions that we can take in at once when we get those requests from our healthcare partners or providers to treat. So we have to then be creative as to how we are staffing our units, how we are strategizing across our market to staff and admit patients. Because the last thing we want to do is deny, right? People need care, and the care continues. So the strategy and being creative is, I would say, more in demand now than it was before. But we also, I think, is starting to see some light at the end of the tunnel as we're getting new grads that are interested in healthcare, but it's going to take time to get those new grads on board, get them trained and ready to start working independently in our settings, whether that be outpatient or inpatient.
Okay. So speaking of the vaccine, do you think that eventually there would be a respect for those who are not willing to be vaccinated, that they're not willing to be vaccinated due to the lack of research. Like, this is kind of quick. We've been studying breast cancer and all different types of cancers for years, and we still don't have a solution. And then they're asking, you know, people to put something else in their body that they're really not sure. So do you think eventually that would be respected, that people prefer a little bit more research before they kind of force people to take this shot?
Well, you know, that's a good question. And I think that people have many reasons as to why they choose not to get vaccinated. And
Right.
let's face it, everyone have a right to what they put in their bodies. I think the research is there. I think, the CDC and, many other organizations have done the studies and provided research on how the vaccine is effective.
Right.
Whether that's Moderna, Pfizer. There's been some controversy with Johnson & Johnson, but there's been some doubt with them all, right? The efficacy rate has been shared with individuals. It's all public. We made sure that we were educating individuals based on age, based on chronic disease. So I've always educated and encouraged making sure you talk with your providers, making sure you have great knowledge as to what's going on and happening with your body before you put anything in your body, whether that be the COVID vaccine or any vaccine, and how that may affect you depending on what you may personally have going on. That's when we start to see, a change or a shift, or symptoms may differ from one person to the next. So I always say be knowledgeable about what it is that you're putting into your body, knowledgeable about vaccines, medications, or anything. You even want to be knowledgeable about your diet, right? So whatever we ingest, whether it's a medication, food, and just through everyday processing of what we drink or eat, you want to be knowledgeable about where you're getting it from and the sources. So make sure we educate ourselves first before we seek, out vaccines or any other medication that we are thinking about receiving or taking. I think it's just important that we know and that we have the knowledge before we move forward with anything that we do.
Okay, I have one last question. So in your opinion, how can we fix some of these struggles, either long-term or short-term, for healthcare workers or for people who are considering healthcare?
Well, there are many struggles. So are we speaking of staffing shortages, resignation, or lack of knowledge, vaccination?
Well, all of the above.
All of the
because for Draylon, my son, he wants to go into nursing, and I have all these questions and fears of all the above. So how do you think that people's minds can be relaxed to say this is still a good industry?
Educate, educate, educate. There's no wrong in educating yourself and knowing which direction you choose to go in, or the choices that you make for yourself. But the more education you have, the more knowledge you have, then the more you would know as far as making the right choice for you. There are many things that we can share as healthcare workers, but even with us sharing that information, it's up to you to do your part on understanding it,
right,
and processing it. And once you have what you need, then I think you can make sound judgment with the best decision for yourself. For me, I had to educate myself on, what was best for me before I got vaccinated. So all of this information and different resources you're receiving, but make sure that it's credible, right? Because you can Google all day and you're Googling and you're misinformed because there's a lot of information that is just not there. It's not fact. And, you know, it can then be confusing as to which direction that you take with making the best choice for you. As far as healthcare struggles and, you know, nursing shortages, the resignation, I think we have a long way to go. I think that it's definitely going to take a lot of recruiting efforts and creativity as to how we are gaining those healthcare workers back, especially because we've lost so many, and we've lost many for many different reasons. One thing I will say is that we've lost several in the hospital setting or the outpatient setting because we have several that have decided to become entrepreneurs. So that's actually a good thing. Right. So they're not stepping out of the healthcare field, but those that have decided to step out of the healthcare field, for whatever reason it is, you know, that's a decision that they decided to make, but it's up to us as leaders to build our communities, to bring awareness to the need, to educate people as to what their choices are, job fairs, and recruit the best of the best, and making sure that we are able to get positions filled timely so that we get hospitals and outpatient centers back to where they need to be.
And before we go, is there anything that you would like to add or promote before we close out today?
Well, I think that, you know, speaking of healthcare workers and some directions that many have decided to take, we have a lot of entrepreneurs and a lot of healthcare providers that have started their own businesses. If you are looking for a dentist in the Chicagoland area, whether that's the south or north side of Chicago, you can reach out to Total Comfort Dental Care online, and it is totalcomfortdentalcare.com, where you can find a dentist, and that dentist can provide care for you in your home if you are not capable, or you know someone that's not capable of getting out and going to the dentist. So wanted to share that, but that is a great opportunity for, you know, oral care is very important. And if you are struggling with getting to the dentist or know someone that is, Total Comfort Dental Care can provide you those services.
Okay, thank you. And we're gonna ask you for the information so we can post it as well. Well, thank you, LaDia, for your time in speaking with us. Hopefully you'll come and join us again to discuss other healthcare problems or issues that may need America's attention. So thank you for joining us at Mask Off, and we appreciate you.
Thank you for having me.